Do you have a health savings account and wonder how it works with Original Medicare? Well, let's break it down. Let's talk about HSAs and how they fit into Original Medicare's picture. HSAs are a great tool for managing healthcare costs, but things change once you enroll into Original Medicare, so it's important to know the rules. Once you enroll in any part of Original Medicare, you can no longer contribute to your HSA. But don't worry, you can still use the funds that you've already saved to pay for qualified healthcare expenses, including Medicare premiums, deductibles, and copays. If you're approaching 65 and you're still contributing to an HSA, we encourage you to stop those contributions at least 6 months before enrolling into Medicare. Original Medicare coverage is often backdated by up to 6 months, and any contributions made during that period could trigger tax penalties. All right, let's do one final recap. You can't contribute to an HSA once you've enrolled into Original Medicare, but you can still use those funds for qualified expenses. You should stop HSA contributions at least 6 months before joining Original Medicare enrollment to avoid those tax penalties. Your HSA savings can cover your Medicare premiums, deductibles, and out-of-pocket costs for your healthcare needs. HSAs are a powerful tool, but it's essential to know the rules once you've enrolled into Original Medicare. Plan ahead to avoid those tax penalties and make sure that you're using your HSA wisely. In our next video, we're going to talk about Original Medicare for people with disabilities and how coverage works if you qualify early. Thanks for watching. We'll see you next time.